Well, we're going to talk a little bit about some technological advances in surgery, and we are happy to have Dr. David Bartholomew, general surgeon at Bronson General Surgery Specialists in Battle Creek, with us to talk a little bit about robot-assisted surgery. And Doctor, welcome to our program. Good morning to you.
Thank you very much. Good morning to you.
Maybe you could tell us a little bit about your background and what a general surgeon is. I mean, do you also operate on lieutenants and colonels? Or no, sorry.
Actually, admirals, mostly. I'm a retired Navy, so that's why I threw that in there. But yeah, a retired Navy. I have 4 kids. 3 of them are in college. And then I have one that's an 8th grader. You know, as a general surgeon, we primarily operate on the abdomen, in the skin. The most common procedures you might know about would be like an appendectomy or gallbladder surgery. Mm-hmm. We also do a lot of hernia surgeries, and really quite a variety of surgeries. And then a lot of us will cover trauma as well and do trauma surgery.
So what is a Da Vinci robot-assisted surgery?
It's a type of minimally invasive surgery, which means we access the target organs, like the appendix, for example. And we do that with small cuts. And so with the small cuts, then you maybe fill that, like if you're operating the abdomen, you fill the abdomen with air, and then you'd be able to see really well in there. And so it's just a sophisticated robotic tool that we use for surgery.
Yeah, I remember hearing, a few years ago when they would take out a gallbladder, they make a big incision, they'd go in there and yank it out of there and sew you up. And then along came this idea that, they could do it with minimal cuts and maybe just poke a few holes and get in there and do what they needed to do. And now we've taken it, a step further with robotics?
With the robotics, kind of changed what minimally invasive surgery was, and it really improved it. There's some nice advantages to the robot over just straight laparoscopic surgery. So the straight laparoscopic surgery, you don't have the ability to articulate your instruments like you do with the robot. And so, one of the big advantages is you have instruments that have wrists on them, and they kind of mimic the things you can do with your hands. So it's a lot like actually being in the abdomen and doing the surgery as if you were in there. You can kind of see things from that perspective, and you're able to essentially use your hands more than just straight sticks like you would with a laparoscopic case. The other big advantage, I would say, is the visualization. With the laparoscope, you're only seeing things in 2 dimensions. However, with the robot, you can see in 3 dimensions, and it gives you a much better depth perception, which makes sewing things a lot easier. You can also flip a switch and use a thing called Firefly. And the Firefly allows you to identify structures that take up a certain dye better than other tissues. And that allows you to, 1, protect certain structures so that they don't get injured. And then it also allows you to identify the structure you're looking for. There's a lot of advantages to it.
Certainly sounds like it. Now, is the sky the limit, or are there only certain surgeries that we're using these type of robotics on?
Well, I would say the sky's the limit. But right now we're using it mainly in the chest and in the abdomen. Those are the main utilizations, is when you're operating in a confined space where you don't have a lot of room.
Did you have this technology at your disposal when you were in the Navy, or has this been since you've been out of the Navy and in the private sector?
The Da Vinci robot, the previous versions, we have the latest version, the XI. But the previous version has been around for well over 10 years. I personally have been using it for about 6 years now. Mm-hmm. Bronson has had the technology, I bet 12 years. And at this time, we now have several of the XI robots, which are the latest and greatest.
If we'd like to learn a little bit more about Bronson General Surgery Specialists at Bronson Battle Creek, what can we do?
Bronson Health, you can go there and look up our page, which is the Bronson Robot Surgery page. It's at bronsonhealth.com.
Great. We'll do that. Dr. David Bartholomew, General Surgeon, Bronson General Surgery Specialist in Battle Creek. Thanks for your time this morning. Great learning about this.
Oh, you bet. Thank you for having us.